Hello, welcome to those of you who are joining. So welcome to people as you're coming into the event. We'll start in a few minutes' time. Make yourselves comfortable and ready for the next hour. Hello to those of you who are joining. We'll just wait till another minute and then we'll slowly start the event. Hello, everyone. It's really wonderful to see so many of you online with us today. So I am Vicky Iglikowski-Broad from the National Archives, and I'm a principal records specialist here. Just for a brief visual description, I'm a white woman with long blonde hair, a particularly today messy fringe, and glasses. And essentially, I work at the archives on inclusion and diversity in our records, often focusing on finding LGBTQ plus voices in our collections, in so I'm particularly excited to be here today. So I want to really warmly welcome you to the final event of our Research Roots series. And this one is on stories of compassion, love and loss, representing the AIDS epidemic. And that's with the National Archives in conversation with Giorgia Tolfo, Bernard Ogden, James King, and Arba Cherkagashi from the National HIV Stories Trust. So our 2025 to 2026 Research Roots program focused on emotion, senses, and feelings in the archives, examining how we navigate the archives in ways that connects to emotions and senses. So I'm just going to do a little quick bit of housekeeping before we kick things off. So this session will last approximately 1 hour, finishing at 2 p.m. And we'll begin with a presentation by today's speakers, followed by the opportunity to ask our four speakers any questions that you may have. Now, this event is being run through Zoom webinar, and that means you can ask questions by submitting them via the Q&A function at the bottom of your screen. So please submit any questions that you have at any point through the event, and then we will circle back to them in the Q&A section towards the end. Should you need any technical support during this event, please reach out to the great team at the National Archives via the chat and they can assist you. And please note that this event is being recorded and will be uploaded to YouTube in due course. We've also enabled live captions. You can access these at the bottom of your screen by clicking live caption, show subtitle, or alternatively, you can hide these if you find them distracting following the same process. So before we kick things off, let me introduce our speakers. So we have Giorgia Tolfo, who works in our research department at the National Archives. Her role involves creating bridges between the National Archives collections and scholarly research, with a focus on digital, spatial, and medical humanities. Giorgia previously worked as part of the Living with Machines project at the British Library and Alan Turing Institute, and in the academic publishing sector. She's also a creative writer, literary critic, and translator. Bernard Ogden has worked in software engineering since 2002 and joined the National Archives in 2020 to work on the application of digital methods to historical research projects. He's interested in digital methods as alternative lenses through which to view evidence about the past and in their potential to offer new ways of exploring and communicating about collections, which we'll learn a lot about today. James King is project manager for the National HIV Story Trust's HIV Story Project, which is funded by the National Lottery Heritage Fund. James manages the delivery of projects, key outputs, including a website, touring exhibition, events, placement schemes, and volunteer programmes. James has previously managed heritage projects for the London Borough of Newham, Thames Festival Trust, and Eastside Community Heritage. And Arba Cherkagashi is currently undertaking an archival placement with the National HIV Story Trust, where he focuses on collecting oral history, interviews, and supporting the delivery of events and exhibitions. He also receives professional support and training through the London Archives. Outside his work with the NHST, Arba is a writer, curator, visual artist, and community organiser of Kosovo Heritage. He's a founder of the project and publication Balkanism and co-founder of the Balkan London Collective. So it's really great to have all of you here with us today. So thank you very much to our speakers. So today, James and Arba will discuss the National HIV Story Trust's mission to film, record and preserve the history of those affected by the AIDS pandemic of the 1980s and 90s. On the 20th of March 2019, the City of London's Guildhall, the National HIV Story Trust, deposited 100 of their filmed interviews with the London Archives, amounting to more than 150 hours of material and making the largest archival collection of its kind in the UK. Giorgia and Bernard will then share their findings from their research into the 1987 AIDS advertising evaluation data set aimed to capture a snapshot of the public reaction to this public health campaign. So to start things off, I'm going to hand you over to James and Arba to discuss the work of the National HIV Story Trust.
Well, thank you, Vicky. Hi, everyone. Very happy to be here. As Vicky said, my name is James and I'm the project manager for the National HIV Story Trust's HIV Story Project, which is funded by the National Lottery Heritage Fund. And yeah, I'm joined by my colleague Arba.
Hello, everyone. So lovely to be here. Thank you so much for the invitation. Yes, I'm Arba. I work with the National HIV Story Trust and the HIV Story Project, focused on kind of activating their material through diverse events, programming, and exhibitions, with the real aim to further kind of highlight stories and broaden the charity's approach to access.
Brilliant. So I'll just briefly say a little bit about the project. We received a grant from the National Lottery Heritage Fund just under 2 years ago now, in 2024, to build engagement around a collection of over 100 interviews, which were recorded over a number of years in the last last decade. Which were then deposited at the London Archive. These interviews are with people living with HIV, friends, family, medical professionals, and activists to kind of tell the lived experience of the HIV and of AIDS, particularly looking in the 80s and 90s. The charity was founded by Paul Coleman initially to collect stories of his friends before those stories were lost. And over time, the amount of interviews collected became so large that it made sense to deposit them at an archive, which, often the lived experience of HIV is often missing from archives, as are many other, topics as well. So I think before we get into the work of the HIV Story Project, we have a short video just to play to you to give a bit of a flavour of some of the material that is held in the archive.
Robbie died on New Year's Eve, so the end of 86, 87. He just escaped having to be buried in concrete. People had to be buried in concrete. I wasn't allowed to view the body.
4 of my lovers died all in the late 80s, early 90s.
I was living in a dark little council flat, which I'm still living in, really. I mean, nothing's really changed. I was on the edge, yeah, all the time. Psychologically, physiologically, spiritually. I withdrew. People were dying around me, as you know. Friends was... My circle of people were less and less. I was very unhappy, yeah.
We were just at that point, if you like, of feeling hopeful about us. And he'd gone to his hospital and he didn't see his own consultant at that time. But he was told, basically, and it was a word which I don't hear anymore, thankfully, but he was told he was a treatment failure.
By the time Robert came out of hospital, he was 4.5 stone. I could carry him up 4 flights of stairs to his bathroom because he wanted a bath in his bath. You know what I mean? We forget this completely devastating impact.
We were supposed to meet on the Monday, and unfortunately I kept phoning, couldn't get hold of him. And by the Tuesday, when I was phoning, the police answered the phone and he'd hung himself.
Nobody thought to test me because I was, straight white woman. I hope it will be different nowadays. I'm pretty sure it will be. But back in those days, I didn't really know any women who were positive.
I wasn't going to tell my friends because I would sit in conversations and people would say, if anybody with HIV was part of a group I was sitting in, I would just leave, And I was sitting right in the middle of these conversations. And I thought, there's no way I was going to disclose my status.
We were all double gloved and double gowned, and he was kept in an isolation room. All of his cutlery was plastic, paper plates. Even his notes had infectious written on them. We didn't touch them without gloves on. His bedding was burnt. I mean, it was just horrendous.
This junior doctor said, does Robbie, I'd like to give him diamorphine, which is a polite way of saying, and I'm going, yeah, fine. He said, does Robbie know he's dying? And I said, yes. And the doctor burst into tears. Doctors and nurses used to go to people's funerals, because in a strange kind of way, we're all in this together. And I think HIV care, in a way, became the model, the gold standard of care in the UK for the NHS.
There's 3 particularly dark hours that I think about still. One was a tall Italian glamorous man who came out of her side room at night time in a blue ball gown and 6-inch heels when 6-inch heels were hard to come by. And he swung around and he just looked so gorgeous. And then he started coughing up bits of his lung. And this blue gown with these dark, dark flecks on it was just so hard. It was just so painful. And he knew exactly what was happening.
I feel sorry for them. They were just wrong place, wrong time. These people they were in the prime of their lives. They never got to tell their story.
Here I am within touching distance of, of retirement age, and I haven't had a paid job for 20 years. I have no pension. I probably won't have a state pension. I have no property. And yet at the same time, both Paco and I are so thrilled that we are alive.
looking at kind of the whole epidemic and looking back at the 80s and the 90s, I'm just incredibly struck and touched by all of the lives that were lost. And for me, as a gay man who's HIV positive, that's part of my story too. All of those who came before me, that's part of my story. My life is very different, but it is part of my story. And I think that I don't want to lose any of that. I don't want any of them to be forgotten, because I think it's so, so powerful to remember all of the men and women who died and to hold on to that.
Within a couple of days of starting medication, it was as though I'd been carrying, I don't know, a 300-pound bag that somebody had just taken off my shoulders, and suddenly I felt like I was alive, and I was well, and I was healthy, and I had just this abundance of energy. I went out clubbing.
They can never be forgotten. They did so much for us, and that's why sometimes I get so angry with the younger people now. They just think, oh look, it's a little, I can take a tablet for it. This tablet wouldn't exist if it wasn't for those guys.
It seems to me that the history of HIV/AIDS must teach us the value of compassion, must teach us the value of hope, because what seemed utterly dark and pointless and cruel has been treated and has been turned into something of hope. And especially in these days when things are strange and turning, you want to hold up this beacon of togetherness and solidarity and unity.
Cool. Thank you. So that short film was produced by Paul Coleman, who is the director of the National HIV Story Trust, and who recorded all of the interviews which you saw in that film and which make up the collection that is held at the London Archives. The strength and purpose of having these stories collected and available publicly to view is that this allows people who had that lived experience to tell their own narrative, so that official accounts and records don't paint a picture that isn't accurate, and that people are allowed to tell their own story and give power to it. And then, as I was saying before, we've now been given a grant to use these stories to build engagement around them. And we are currently in the middle of a 3-year project called HIV Story, Building Engagement. So I'm just going to very briefly tell you a little bit about some of the work that we've been doing. So we began by creating a project website called, which is www.hivstory.org.uk. I'll put it in the chat after this as well, which houses 40 of the interviews in edited short format. So immediately you can go online. Thank you, whoever put that in the chat there. You can go online, you can watch a 3-minute or a 20-minute version of the story. It also has a written description of the story as well, to get you kind of, to give you an understanding of the wider kind of stories that are held by the archive. So that's our online kind of base for the project. We've then got a touring pop-up exhibition, which again uses those 40 interviews with quotes and QR codes. We are currently looking for opportunities for the exhibition to go around. It's one piece exhibition that has been going into public libraries and into all sorts of other spaces. If you would be potentially interested in hosting our exhibition at your venue or at one of your events, we'd love to hear from you. And I'm just putting my email in the chat so you can reach out to me to discuss it, and anything else about the project. Be delighted to hear from anyone about this. We're also running volunteer programs. So we've run one volunteer program in London, and this involves training delivered by the London Archives around archival research and around oral histories, and then having the opportunity to use the interviews to create a kind of final project output. So last year we had a group of 10 volunteers who researched the collection of stories before being led by a facilitator to write their own creative responses. So we created a zine of creative writing pieces by our volunteers, which we launched last year. We've just recruited a second volunteer in London, and if anyone here is based in south of Wales, we are going to be recruiting a cohort to work on a project at the National History Museum in Cardiff very shortly. So keep an eye out on our website and social media channels for more information about that. I should also say that we're working with several partners on this project. So the London Archives, the Royal College of Nurses, Newcastle University, and University College London. So all of the project outputs, we're working in partnership with these organisations to deliver our project outputs. We're also recording new stories. So the Royal College of Nursing have recorded an additional 30 interviews with nurses all around the country to better understand the medical perspective, the experience of nursing HIV, and that is going to be continuing throughout the rest of the project, going on for the next year. And then we're also running 3 paid archive placement positions. So one in the northeast of England, based at Newcastle University, which has just started a month ago. And then we have another one based at the London Archives, who is my colleague Arba, who is with me today. So I hope that's given you kind of a brief overview of everything we're doing with the project. And I would, now like to pass over to Arba for him to talk a little bit about the work that he's doing as part of the HIV Story project.
Thanks so much, James. It's so great to be here and to speak on this. So like James said, I've been working with the National HIV Story Trust and the HIV Story Project for the past, I think it's coming up to 5 months now. And my role has been really focused on working very closely with Paul Coleman, which is the co-founder and director of the National HIV Story Trust, to really kind of collate his own personal story, because what's really fantastic about him is that he was really central to kind of recording those 120 stories and kind of archiving them. But his personal story, his personal lived experience of dealing with HIV and his own life journey really wasn't archived in an oral history kind of dynamic. And then also the kind of foundations of the organization, we really wanted to be able to archive that story, because it's all well and fine to actually have the archive, but learning about the way that the archive manifested as a space, I think, was really significant and important. So my role within the placement has been really focused at working very closely with Paul. And it's very poignant because in the film itself, it spoke about how the younger generation potentially don't know about what happened in the 80s and 90s and that kind of process of remembering. So it's been a very poignant experience working with Paul, having kind of really in-depth personal conversations about his own personal experience with HIV. It's been very, very cathartic for me as an individual who is a part of the LGBT plus community. I'm really fascinated and intrigued and interested in LGBT plus history, but to hear it from individuals that have lived it personally, I think is really significant. So I've been working really closely with Paul for the last 5 months or so. We have like weekly sessions where we basically just engage in conversation about his life experiences. And I think kind of like the job of an oral historian, it doesn't really feel like a job often because you're just literally sitting down and having conversations with people about their lived experience. And we are currently gearing up to actually recording two of his stories, one focused on his own personal narrative and the other focused on the development of the National HIV Story Trust. And you saw that kind of like short trailer. Initially, the National HIV Story Trust was really founded around kind of the desire to make a feature film documentary that would be kind of presented in the UK. I think that is something that's still in the works, and there is a desire to ensure that this film and material is being accessed on a kind of national level. And so the project kind of grew out of a response of that. You know, Paul had kind of cultivated and kind of built an archive of these stories and wanted to basically ensure that other individuals could access this material as well. And I think what's really amazing is that so this current archive is available at the London Archives itself, and it's a massive resource that I think will be available for the next 1,000 years, which I think is kind of like such a legacy to kind of bring forward. So yeah, that's my work with Paul. I've also been getting some kind of specialist training at the London Archives as well, which has been really fantastic. So working very closely with the engagement and learning team to kind of understand the way that we're able to actually activate archival material, which is something that really kind of feeds into the work that I've been doing with the National HIV Story Trust. A big part of my kind of role has really been thinking about the way that we can activate the material that we have. I think there's sometimes a lot of disparities in the way that we're able to engage certain communities that may experience HIV. There are still kind of a lot of problematic associations or stereotypes about who kind of is more susceptible to getting HIV within the British context and also historically. And I think the National HIV Story Trust has been really focused at breaking down those stereotypes and also working very much on a national level. Often there tends to be a focus on urban centres like London or Manchester, Liverpool, different environments in the UK. But making it nationally, I think, really breaks down those kind of structural elements that really don't represent the full experience of what it is to have HIV within different environments and also from diverse contexts and experiences. So a big part of my role, like I said, is kind of trying to activate that material in a bit more of an intersectional way. And so we're currently gearing up to producing an event in April, hopefully, which will be focused at bringing people together from different generations to really speak about experiences of HIV. Because I think sometimes if communities and peoples don't speak to each other, there is that kind of internalized lack of understanding between both. And so I think it's a really fantastic thing that, you know, the project is bringing people together. And we also will be working on an exhibition, hopefully being launched sometime later this year, all around the kind of different forms of activism that kind of related to safer sex and practices of safe sex in the 80s and 90s. So yeah, this has been my personal experience, and it's been really great working with such a fantastic team that are building such a legacy within the British space as well. So yeah, thank you.
Thank you very much, James and Arva. That's been really great to hear. And I like the way that this is very much developing work. It's great to hear about the extra nurses' voices being added to the collection, and great to see where this all goes. Thank you as well to everyone who's been commenting in the chat. It sounds like there's great projects going on across the country, which is really exciting to see. So anyone else, do introduce yourselves and also share resources. And just a reminder before we go into the next section that you can put questions in the Q&A box. So either for James and Arba or Giorgia and Bernard. Okay, so thank you so much. We're now onto the section of the talk for Giorgia and Bernard. So I'm going to hand over to them and then we'll come back to any questions at the end. So I think Giorgia, over to you.
Yes, sorry, sharing this. Okay, right. Okay, hi everyone. Thanks James and Arber for presenting, and to Vicky and everyone who has organized this event. I'm Giorgia Tolfo. I'm a collection researcher, so I sit in the research department at TNA. And today I'm presenting on behalf of me and my colleague Bernard. So it's just me speaking, but it's work that we have developed partly together. It's really hard to speak after James and Arber because I work at the National Archives, therefore at the Archive of the State. And as you can imagine, what a state archive holds in terms of documents related to the HIV pandemics is not doesn't have the same effective weight or presence of lived experiences as what we've just seen. However, it was probably, however, as you can imagine, what we have might often be read a little bit against the grain, and it still gives us a snapshot of what those times were, mostly from the perspective of the state and who was sitting at the state. As you can imagine, we've got governmental correspondence, we've got charities registrations, and within this record, it is possible often to find traces and archival traces of people's thoughts, opinions, or leaflets, for example, as this slide shows. Here I've put two records. One is a selection of Terence Higgins Trust pamphlets that were associated with the charity registration. And on the right side, it's a note written by Margaret Thatcher on an internal note where she expressed her concern about talking about sexual experiences in the public health campaign that was currently being planned, 1986-87, the one that became known as, or infamously known as, the Don't Die of Ignorance. She says, do we really need to talk about sex? Some student, actually I've got it here, sorry. Do we have to have the section on risky sex? I should have thought it could do immense harm if young teenagers were to read it, and you can see it scribbled on the document. So these archival traces are often found in official documents. But the biggest share, I don't know if it's the biggest share, but one that really stands out in our collection is everything that was done around the public health campaign. The 1986-87, which I've just mentioned, was really important public health campaign. It wasn't the first state public health campaign, but because of its mediatic impact and how it was planned, it really, and because it uses really some like strategic means, like it was very scary. It wanted to create panic around HIV, maybe not deliberately, but it is what it did. So we got pamphlets, and then on the right here you can see a storyboard of what became the original storyboard of what became the TV advert. Interestingly, looking at it, there are some images that were taken out at the end in the final version, like the first image is a siren, so it should have been even more scary than it was. But again, this is to say that these records can offer glimpses of life or opinions, but not the lived experiences. And it was probably because of that when I came across this document that sits in, and it is openly downloadable in our catalog. It's called 1986-87 AIDS Advertising Evaluation Dataset. I was particularly interested in this. So from what I could read in the catalog descriptions, the dataset contains data collected as part of HIV advertising evaluation, and it is derived from interviews and questionnaires with people. And I thought that it might include people's perspective in that. And I was kind of trying to find these archival traces of lived experiences. I wanted to find those feelings. There's the famous work, Archives with Feelings. I wasn't sure I could find them, but this seems a good place to look at. So I downloaded it very, I can't say excited because it's not the right word, but I was really hoping to find those traces. As I read through a printed report, associated report that can be found online on the Web Archive or Welcome, which is the one in the picture, the blue with the blue cover. During the campaign, there was a survey where they interviewed 700 people at 4 points in time, so throughout the year, because they wanted to see whether what they thought about HIV, what they, especially in relation with other diseases and illnesses, was like more worrying or less worrying. The questionnaire also had questions around some of the stereotypes that were circulating. So they were trying to capture whether across the period of the campaign, people's opinions changed. And they also initially captured some information around the sexual lifestyle. These 700 people, interestingly, were interviewed partly in gay venues, which were selected with some support of for example, Terence Higgins Trust advised on what could be good venues, and others were just randomly selected, so we're not only gay. So there was a sample that was gay only, one was gay and young people, another one was just mixed people. Interestingly, there are not that many information about ethnicity, so of course this is a really biased survey. However, it seemed a really interesting point to start. So I downloaded it, got really excited at this point, really excited about the document more from a digital perspective. But then when I opened it, unfortunately, what it contains was basically each interview was divided into waves according to what the sample was. Every simple wave had like 4 different Excel files. Trying to combine all of them was a bit of a mess. You had file encoding, this is how it looks. So these are the results. And I was like, what is this? It's really complicated. So that is where Bernard came into place when I walked to him and I asked him if he could help me. I did a preliminary attempt. I reconstructed it with Python. Then my skills weren't that evolved. So he, as a digital researcher and a software developer, was able to preliminary reconstruct it with more work probably than he expected. So I don't know if he was happy for my approach, but he was able to reconstruct the data. So now we could see all the questions in every single column with the answers. But there are so many different exceptions and differences that when he fully reconstructed with like all the exceptions left out to be, so it's not final but semi-final, we got to a document that had 61,700 cells, which is, as you can see, not only unreadable in this way, but it also raises questions about the research itself. It made us wonder whether, as research, how we felt thinking about lived experiences as cells in a spreadsheet. What about people? What about the lived experiences behind this data? I really personally, and talking with Bernard, we felt we had to kind of contextualize that a little bit. So that is when we decided to move into, I decided to, with the support of my entire team in research, to develop a research program around that. And I organized at the end of the year, because we are now talking about 2024, a symposium. A symposium and a workshop. So it was 2 sections. We would have done a workshop to work with that data set with some researchers, but that workshop would be anticipated the day before by an open access online symposium where I've invited people from across the sector, researchers, and so on to speak about their collections, about their work, and then to reflect in a way of what archives of HIV and AIDS mean for research, for our understanding of HIV, for memory work, and for visibility, and so on and so forth. The symposium was divided in 4 main panels. It has institutional collections first, so we reflected on on what us like state archives or local authorities might have. We looked at community archives like, of course, Bishopsgate and just to mention one, but we had also UAL, we had George House Trust and others. Then we had historians working with oral history, working with policies or like HIV and kids. And then we have also a section dedicated to creative and digital responses where we also presented this work. In this symposium, one presenter, Chris Olver, presented his survey of HIV and AIDS archives in the UK, which had just been published or was about to be published. Actually was about to be published, which you can find at the website that I've put in the slide, but you can also probably type what I've put in the slide. And I've seen in the chat so many interesting projects, and this idea of mapping archives and collections to give the fuller picture has become one of my main aim, because as a state archive, we only have those records, and they can't exist in isolation, because community and state, in a way, like although they clashed, they also provide different views, and for as difficult and sometimes violent records of the state can be, they also can be particularly interesting in terms of like medical research and how that was approached. During the workshop in person, for example, we looked at the data, as I told you, the one I just showed you, but it was in that context that we had Virginia Berridge and Kay Wellings, who were involved originally they were like so one is a historian and one was a consultant at the time for health department and stuff. Sorry, I don't remember her role, the exact role. I hope she forgives me. They were there, and looking at the data set, they reminded us as how looking at the first survey of the responses to our public campaign, so to marketing, really made it really important to understand what were the sexual habits of people in order to prevent long-term the proliferation of HIV, so how sexual health, sexual education, and prevention was important. And it was in that context that NATSL, that became the National Survey of Sexual Attitudes and Lifestyle, sort of was born. Unfortunately, it wasn't supported by the state, although the researcher at the time reached out to the Department of Health, as I found in records, because again, Thatcher expressed her feelings around that. And again, this is interesting because sometimes there might be like ways of working, and government might make decisions through different protocols, but there are also personal opinions that sometimes might come in their way. This on the left is a circular where she says, actually, her secretary reports that Prime Minister Margaret Thatcher has commented that she is absolutely opposed to such a study, which would be NATSL. Attitudes and behavior, and doesn't think that it is necessary. As we know, it was necessary. In fact, NATSL is still going on. Every decade is run in the UK. She believes that people would rightly be deeply offended by questions of the kind proposed, and she feels strongly that the government is not entitled to intrude into their privacy. Records show, however, that civil servants working in the Department of Health and many other people were really in favor and supporting this. So the conflicts of opinion sometimes come in the way, and records of the state show this conflict. Often what we see publicly is the outcome of it, but behind it there's always more. I'd like to finish, sorry if I overrun a couple of minutes, with a sort of like reflection of what happened. I started thinking through a digital record but what it led me to was to an interdisciplinary, collaborative, inclusive form of research. And I think that important archives are a little bit like what you see in the picture, which is the HIV UK quilt. And they also were present in the workshop, and they presented the work of preservation that they are done, and creative also doing with the quilt, the UK quilt. Archives are a little bit like that. Each archive has a portion of a bigger picture, and it is nice to bring them all together. I think that symposium was that. It started with a record and a form of discomfort that I have in front of digital only research, but it led to an experience that I thought was useful. Clearly, it didn't include everything. As I mentioned, I've seen many projects being mentioned in the chat, and I wish somehow I had known, but also they wouldn't have much time to include everyone. There's always limits to curation, and of course, it showed that there also inclusivity is important. Sometimes it's really hard, and it was really hard for me to reach to lesser known archives and collections, or practitioners, or archivists, but also it made me question what my channels to reach this landscape of work around HIV is. Just saying that, feel free to reach out to me. You can find my email on the National Archives website, because I would like to enhance and support more collaboration through archives. And if there's anything that we can do in future and develop more work, I'm trying to develop more work, and so stay tuned. Just to finish on this note, unfortunately, a state archive doesn't have those lived experiences, but sometimes it can spark that element that brings us to then bring in people that can enrich those records, or respond to those records and provide a bigger picture. And so together we can do a bit of memory work if possible. So that's me. Thanks for listening.
Thank you very much, Giorgia. That's a brilliant kind of very contrasting insight into collections, but a really useful one to sit next to the kind of lived experience that we've discussed. So there is time still to submit questions, so feel free to do that. And just to say, there's some great chat going on as well, highlighting lots of different collections, including other oral histories. So thank you for sharing that. And hopefully, as Giorgia says, we can kind of work together in this kind of everything coming together, like the kind of wonderful AIDS memorial quilt, to kind of amplify and highlight each other's work. So just to start off, a kind of theme that's come up a few times is about the voices that we've been able to capture, the diversity of experiences. So James and Arba, there was one specific question about any trans histories. Giorgia, I can always bring that to you about the National Archives collections. But I guess more broadly, have there been kind of voices and experiences that you've struggled to be able to include or find people kind of willing to contribute, and how do you navigate that?
So I would say that so firstly there are trans voices in the collection. What I would then say just firstly is that maybe Arba can add more to this than I can, but we were brought in, a bit later after the collecting. We're now kind of more focused from our side on the engagement around the collections. So I wouldn't feel confident speaking about how those collections were brought together. I don't know, Arba, you've been speaking with Paul. Maybe you have more of a understanding around that than I do.
Yeah, I think initially it was kind of done in a very grassroots way, in the sense that Paul was very much kind of like asking friends of friends of friends to kind of contribute to the archive, to the collection in that sense. So it was kind of like it grew very naturally and organically in that way. But I think there was a lot of internal conversation, because I know this is something that Paul is very, and also Nick, that are both co-founders of the organization, are very much dedicated to ensuring that we do get as much lived experience represented within it, because it's very much the national National HIV Story Trust, and so it must represent the kind of the like lived experience from multiple different lenses. And I think these conversations have been had. I know that myself and James have had conversations about including members of, communities of color, individuals and experiences that are not represented within the discourse to do with HIV. I myself come from a Muslim background, and oftentimes these conversations are not properly had within my own community. And then it comes to the intersections of being Muslim and queer, or a Black person and LGBT. And so these are kind of key conversations. But I know within the kind of structure of the organization, there is a real fantastic emphasis at kind of ensuring that these voices are represented, and also making space for specific individuals within the community that have been providing space to those intersectionalities of lived experience as well. So we have an interview with Arnold, I forgot what his surname is, but he was one of the founders of the Black Liners, which was a specific helpline for members of the Black community experiencing HIV in the 80s and 90s. So there's really been a focus to ensure that we're kind of approaching this in a very intersectional and diverse way.
Just to quickly add on there regarding kind of collecting going forward, that given that the organization is the National HIV Story Trust, a big part of this project is ensuring that we are, looking into the regional elements of the national HIV story, as Abba was saying earlier. In places like London or Brighton or Manchester, perhaps that story is better catalogued and preserved than in places such as, rural areas of Northeast England where HIV existed but was, more disparate, and therefore isn't as potentially well represented in archive collections. So that's what our work with Newcastle University, for example, is focusing on. And I've seen a couple of people in the comments talking about working in the Northeast. So it'd be great to hear from people on that front. So.
I could also add something to that, because that is basically the question that has been troubling me for a long time when I created the program. Making the program meant doing research and then talking to people and people suggesting other things. And so it was a bit of like, as you know, it evolves through words of mouth, through further research, and I think and the data set as well, the original one that I found, so that doesn't have ethnicity. For example, of course, the category trans was not at the time captured, because we are looking at historical data. So like people self-identifying as trans or non-binary weren't captured in those surveys. I mean, let alone the ethnicities as well. So and then when it came to organizing the program, I really struggled finding smaller groups, and then of course smaller groups talking to different lived experiences. Abba, you rightly mentioned the intersection with religion, with faith, and the intersection with ethnicities and all of that. But there's of course a capacity problem in our one-day program, so you can't fit everything. But also for me, it was really I found it difficult to find. And then after the symposium, I had conversations with people, and then you realize that there is more, and you can scratch the surface, but there is always a starting point, and the starting point is a little bit limited as well. I know that there's a lot of work now developing in different universities around global activisms and the impact of the UK, because of course I was focusing on the UK only. I know there's a lot of interest in global majority forms of activism, how they've influenced activism in the UK, so transnational forms of activism. And I think that is really interesting. It is like the people of color, that is a massive group that in the symposium was not represented, and I felt bad about that. But I reached out to two people who have became sort of the representative of the entire group, and it's not right for them to be the only representative for the community. But at the same time, the question is how can we reach out to people, or what are the channels that we use? So I really yeah, I really advocate for like a sort of like a connection, connecting and sharing, because I suppose that is the only way we each other like put each other under the radar. I don't know if there is a solution, but I am trying however I can to see whether there's a way of enabling or facilitating this, because then archives tend to represent those stereotypes of like the smaller community, the wider community represented is who's remembered historically. But what about the others?
Yeah, thank you very much, Georgia. It's great to hear the kind of yeah, the different angles on the issue of kind of diversity of voices and how we try and build those kind of connections. So I was wondering more of a kind of National Archives question, but how can large institutions, I guess in general, learn from these more grassroots approaches to memory keeping and storytelling? I think we've seen some of the contrasting natures of the collections, how we have these big spreadsheets versus these really poignant, important lived experiences. And yeah, I don't know if Georgia or Bernard, you'd like to reflect on that at all?
Maybe we can involve you as well, Vicky, with the work that you do in this conversation. Sorry, Bernard, if you want to also jump in. I'm just saying something to start with, which is like the flexibility and also the role that the State Archive has. So, for example, our collections, maybe many of you will know, are regulated by the Public Acts. So, what is preserved is preserved because it has to be legally preserved. We don't accept donations. We don't create collections around like themes. Our documents are organized by department. So this it's a different way of so there are protocols, there are procedures, and it doesn't have the flexibility, but also the freedom of a community archive that can accept donations, can invite people to share. So I suppose, and I'll stop here because I don't want to take too much time, but I suppose that symposium for me was a way of like kind of like doing in a state archive way what people can do in a smaller archive, which was like bringing people together and trying to put things in context, bringing and enriching that and sharing and there's way more to learn, there's way more to share, there's way more that can be done, there's always more, but we have always to start somewhere. That's the point.
Thank you. And you know, I guess the grassroots approach is building kind of trust authentically, and we come with as a large institution with the weight of the kind of association with government, which obviously has kind of had historic challenges in their treatment of certain people. And yeah, so definitely I think lots to learn from the kind of grassroots approach of also kind of going out of the archive and trying to kind of meet people where they're at, I guess. Well, thank you. We're getting towards the end. So, James and Arbor, I wondered if you could talk to the kind of responsibility of dealing with these collections that you do, and how that feels when they're so kind of emotional and poignant and contain this lived experience, and how you kind of navigate that.
I can start that as well. I think the conversations that we've been having are also really focused at building trust with communities. I think that is at the fundamental basis of building an archive and ensuring that individuals feel properly represented within the way that we're kind of like housing their story for future generations. So I think that's something that has been really kind of like a core foundation, and also seeing myself as not someone who's interpreting their story, but as an avenue through which their story can be fundamentally housed within this archive, because it's very understandable, especially potentially working with members of the older generation that potentially have views or opinions that may completely differ to mine. And so understanding that, you know, that oral history interview isn't a focus on my personal beliefs or opinion. It's more so just a space for them to express their lived experience. So really kind of honing in on that, our ability to really kind of build trust, I think is at the fundamental core of building an archival kind of collection and ensuring that that reputationally we're also protected and that we're able to sustain ourselves as a project as well.
Thank you. We have had a couple of comments about the HIV Trust collections and what the stories hold, so particularly about migration, any stories that relate to migration, and also people who've been incarcerated. So I guess we can't get to everything, but could you signpost us where people can find out more, or if you have any specific quick responses to those two?
I did realize we were kind of running out of time, so I wrote a few responses to some of those questions. But yeah, I would just then repeat that to go onto the HIV Story website, which is hivstory.org.uk, or to contact myself via email, which I've put in the chat, to find out more about the project. And if you have any particular thoughts on collaborations or partnerships, we're really, really keen that we are working in partnership as much as possible across our project. So yeah.
Great. Thank you ever so much. Sorry we didn't get to everyone's questions, but thank you, Giorgia, Bernard, James, and Arba for joining us today and really providing amazing insights and the important ways archives and communities are working to represent the AIDS epidemic. And thank you very much to all our audience for joining today. So as you heard, this is the final Research Roots session of the year. Please keep an eye out on our LinkedIn and via our research newsletter for more information about future Research Roots events. The link to subscribe on our newsletter is going to be shared in the chat. And if you want to learn more about HIV and AIDS records at the National Archives, a link will also be shared. And you've just heard James mention the HIV Story Trust website as well. We hope you've been inspired by our Research Roots series to engage with collections in new and innovative ways, focusing more on feelings and collaborations. Have a great weekend, and we'll be back soon with more of these events. Thank you, everyone.